The Meghalaya Department of Health and Family Welfare and National Health Mission celebrated a decade of the Rashtriya Bal Swasthya Karyakram, highlighting its impact on child health. Health Minister Dr. Majel Amprin Lingdaw praised the program for tackling birth defect diseases and developmental delays, stressing the need for better healthcare accessibility. Partnerships with NIGRIMs and local hospitals aim to bring treatment closer to home. The event honored frontline health workers and mobile medical teams, while East Khasi Hills Deputy Commissioner R.M. Korba urged greater community involvement through village health councils. As RBSK enters its second decade, the focus remains on early intervention and strengthening local healthcare.
See, the RBSK program is a program which is initiated by the Government of India, where it targets birth deficiencies of children from birth to the age of 19. So this program has various interventions, and through this program the citizens come for screenings and we detect the deficiencies, or what we call the 4Ds of diseases that can hamper a normal life in a child. One of them is defects at birth. For example, you have a cleft lip, you have a palate cleft, then you have the congenital heart diseases, then you have what we call the clubfoot. These are all deterrents in children that stop them from living a normal life. Then we also have diseases, different kinds of diseases that can be a big threat to the normal lives of children. One of them is skin infections. Then we also have rheumatic heart problems. Then we have heart diseases of these natures. Then we have the deficiencies like autism, hearing, speech delay, cerebral palsy. Then we also have developmental delays and disabilities such as autism. We also have problems with speech in children. We need to make sure that the communities feel that the government is here to help them. And these mobile health teams are found in all parts of our district. Today, the RBSK program has just passed its first decade. And here today we have our workers from the Khasi Hills areas, inclusive of East Khasi Hills, Southwest Khasi Hills, West Khasi Hills, and the other districts here in Khasi Hills region. And we are commemorating good efforts put in by various teams from various districts. And we're rewarding them because of the work that they're doing. So, the government today is of the opinion that we must empanel our own local hospitals so that our people can find convenience while getting treatment within their own homes or around their own homes or within their own district. So we are now trying to empanel institutes so that they become equipped to conduct the basic surgeries. And we are also working in close connection with NIGRIMs and the other hospitals of the state government to ensure that all these children are covered under the scheme. Cost of the project, cost of the surgeries, everything is attended to. But this information needs to go to the public. And public need to be aware that do not be helpless or hopeless. Government is attending to these problems. So therefore, I have attended this celebration of 10 years of the RBSK program, and we hope that through this program, we will be able to attend all issues that deter a child to right of life.
One thing I would like to point out here is that, our district, I'll speak on behalf of my district. In our district, we have a population of 10 lakh people, and in each group of 0 to 19, it comes about 7 lakhs. So you can imagine we have a very, very young age group in our district, and this calls for rigorous work for all of you. We need to improved further, we need to go further. And just one thing that I would like to request you is that I know it's very difficult to find people and people to come forward, to give you the information. So basically, in the rural areas, I find things much better because there's in place a system where we have the VHC, we have the VEC and things like that, whereby, if we move from the district and we send letters to the VHC or, the various councils that they have in the village level and tell them that, we are looking for children who are having these issues. So we were just talking about that only, like maybe we can go through that level of connecting with the village health council, because I know if you go on your own it's very difficult. So we do have very good VHCs in the district. Out of the 900 plus that we have, I think so more than 250, they're very, very good. So if you can identify and talk with them and have a close network and collaborate, work in a collaborative mode with them, you will definitely find results, And basically, as a team, when you go, you also talk to them, to those VHCs. And what I found when I went for, to review or visits, inspections to the village, most of them, when you talk about the VHCs, they're supposed to talk about 13 things, and about 13 issues, but they keep on talking about cleanliness. So they don't talk about the various kind of things like we talk about teenage pregnancy and things like that. I mean, those are outside this topic, but then what I want to also will look into this with Dr. Lisa and maybe include these 4Ds also, which we're talking about under this program, to be included in the VHCs. We'll write a letter to them and we'll tell them to kindly identify from your end, because if we as outsider go, it's very difficult to get the information. But if it comes from the village, I think so that will be more meaningful and we'll get the correct information. So I really thank all of you once again, and keep up the good work, and wishing all of you to stay healthy. First of all, you guys have to stay healthy yourself to be able to provide help to other people. So keep yourself strong, and we hope to celebrate more of your achievement in the near future.